Good morning, everyone. Today we are going to start with the new topic that is under the disorders of endocrine system, thyroid diseases. So, as the name suggests, it is diseases. It is not a single disease that we are going to study. We are going to study the multiple diseases under this particular topic. Okay. So these are the contents. So first of all, we are going to study the functional disorders. So there are under hyperthyroidism, then we have hypothyroidism, and we have cretinism, and lastly the myxedema. So the cretinism and myxedema are actually the parts of the second type, that is hypothyroidism. And lastly, we are going to study the goiter. Okay, so this is the reference that we have used for this particular topic. So let's see the first, that is functional disorder, and in that the first one is the hyperthyroidism, or which is also known as thyrotoxicosis. So hyperthyroidism, also called thyrotoxicosis, is a hypermetabolic clinical and biochemical state which is caused by excess production of thyroid hormones. So it is very simple, as per the name suggests, hyperthyroidism. So hyper means excess, thyroidism related to the secretions of the thyroid gland. So when the secretions of the thyroid gland, that is the T3 and T4, when they are in excess, then it leads to a clinical and biochemical state which is known as the hyperthyroidism or the thyrotoxicosis. Okay, so this condition is more frequent in females and is associated with rise in both T3 and T4 levels in blood, though the increase in T3 is generally greater than that of the T4. Okay, so let's see the etiopathogenesis. We have divided the etiologies into some common causes and some the less frequent causes. So the common causes, they are the Graves disease. So it is the primary disease in this condition is the Graves disease, which leads to the hyperthyroidism. Okay, so this Graves disease is also called as the diffuse toxic goiter. Okay, so second most common cause is toxic multinodular goiter. Okay, and the third most common cause is the toxic adenoma. So these three, if these any of the disease which is mentioned over here, if it is present, then it can lead to the hyperthyroidism. Okay, so adenoma, it is like a tumor of it. Okay, so the less frequent causes, it includes hypersecretion of pituitary TSH by a pituitary tumor. Okay, second less frequent cause is hypersecretion of TRH. Okay, third is thyroiditis. Okay, so itis, it is inflammation. Okay, then we have metastatic tumors of the thyroid. Again, it is a less frequent cause. Then we have another less frequent cause, which is also which is called as struma ovary. Okay, then we have congenital hyperthyroidism in the newborn of mother with Graves disease. Then HCG secreting tumors due to mild thyrotropic effects of the HCG. So example of it is Hydathy deform mole, choriocarcinoma, and the testicular tumors. And lastly, the less frequent cause is by excessive dose of the thyroid hormones or iodine, which is called as Jod-Bezdo disease. Okay, so these are all the less frequent causes of the thyrotoxicosis. Then the clinical features of the thyrotoxicosis, they include the patients with hyperthyroidism, they have a slow, insidious onset, and it varies in severity from case to case. So the usual symptoms are emotional instability, the nervousness, palpitation, fatigue, weight loss in spite of good appetite. So there is no problem with the intake of the food, but still there is weight loss, then heat intolerance, then perspiration, then menstrual disturbances. As it is more common in case of women, that's why it is mentioned, so that there are disturbances in menses. Then fine tremors of the outstretched hands. Okay, so next, cardiac manifestations in the form of tachycardia, that is elevated heart rate, then palpitations, and the cardiomegaly are invariably present in hyperthyroidism. The skin of these patients is warm, moist, and flushed. Weakness of skeletal muscles and osteoporosis are common. So the typical eye changes in the form of exophthalmos are a most common feature in the Graves' disease. So if the Graves' disease precedes to that of the hyperthyroidism, then the protruding eyes, which is the characteristic feature of the Graves' disease, will be evident, will be present in such cases. Okay. So next is hypothyroidism. Hypothyroidism is exactly opposite of hyperthyroidism. Okay, hyperthyroidism, if it is excess secretion of thyroid hormones, then hypothyroidism is the less secretion or deficient secretion of the thyroid hormones. Okay, so it is a hypometabolic clinical state which results from inadequate production of the thyroid hormones for prolonged periods, or rarely from resistance of the peripheral tissue to the effects of the thyroid hormones. Okay, so two things are there in this particular definition, is that there is a hypometabolic clinical state. Second thing is that there is a decrease in the secretion of or production of the thyroid hormones. And the third thing is that the thyroid hormone levels may be normal, but the peripheral cells, they are resistant to the actions of it. But this third condition is the rare one. Okay, the second condition, that is the inadequate production of thyroid hormone, it is like the most common thing or most common feature that we have seen in case of hypothyroidism. So the clinical manifestations of the hypothyroidism, it depends on age of onset of the disorder, and hence it is divided into two forms. The first is the cretinism or the congenital hypothyroidism. Okay, so it is the development of severe hypothyroidism which happens during infancy and the childhood. So we can say it is a juvenile type of hypothyroidism. Okay, then second type of hypothyroidism, depending on the age class, is the myxedema. And myxedema, when we can call it as a myxedema, when it happens in the adulthood. Okay, so that these two particular disorders or these types we are going to deal with in detail in next few slides. So the first we are going to study about cretinism. So this cretinism is it comes from a particular word, that is cretin, and it is derived from the language, that is French, and it means Christ like. Because why the children who are born with the severe hypothyroidism, they are called as Christ like, because they are so mentally retarded that they are incapable of committing sins, and hence it is called as the cretin, or which means the Christ like. Okay, so cretin is a child with severe hypothyroidism which is present at birth, or developing within first 2 years of the postnatal life. Okay, so this is the period when the brain development is taking place. In the absence of treatment, the child is both physically and mentally retarded. Okay, so it means that if treatment is given, then we can actually prevent the retardation of the growth, as well as the mental retardation can be prevented. But if treatment is not given, then the child, he or she becomes physically and mentally retarded. Okay, so etiopathogenesis. So the causes of congenital hypothyroidism, they are as follows. So the first one is the developmental anomalies. Okay, so example is thyroid agenesis and the ectopic thyroid. Then second cause of the congenital hypothyroidism can be the genetic defect in the thyroid hormone synthesis. Example, defect in iodine trapping, oxidation, iodination, coupling, and thyroglobulin synthesis. So you have already studied about this in the human anatomy physiology uh, 2 course about that how biosynthesis of thyroid hormone occurs. And if any of the step which is mentioned over here, if it is defective, then it can give rise to the defective secretion or production of the thyroid hormone, and hence the hypothyroidism. So fetal exposure to iodides and antithyroid drugs can also cause the congenital hypothyroidism. Then we have endemic cretinism, which may happen in regions where there is presence of endemic goiter, which is due to the dietary lack of iodine. Okay. So next is clinical features. So the clinical manifestations usually become evident within a few weeks to months of birth. The presenting features of creatine are the slow to thrive, poor feeding, constipation, dry scaly skin, then hoarse cry, and lastly the bradycardia. Okay, so as the child ages, clinical picture of fully developed cretinism, it emerges characterized by impaired skeletal growth, that is the impaired physical growth, and the consequent dwarfism, that means that particular child is unable to grow to a certain height, the normal height which we are talking about. Okay, then round face, then narrow forehead, then widely set eyes, then flat and broad nose, big protuberant tongue, and the protuberant abdomen. Okay, so the neurological features include the deaf mutism, spasticity, and the mental deficiency. Okay, so and it is more evident in sporadic cretinism due to the developmental anomalies and the disharmonogenetic defects. Okay, so next we have that is myxedema, and it is hypothyroidism that takes place in the adulthood. Okay, so this term myxedema, it connotes non-pitting edema due to the accumulation of hydrophilic mucopolysaccharides in the ground substance of dermis and other tissues. So this is the characteristic feature of the edema which is caused due to the myxedema. In the name itself there is a edema. Okay, edema is associated with the increased in blood volume. Okay, so in congestive heart failure also there is edema, but that one is the pitting type of edema. But this edema which is associated with myxedema is non-pitting type of edema. Okay, so etiopathogenesis, there are several causes of myxedema which are listed, but first two are the most common causes. So the first common cause is the ablation of the thyroid by the surgery or radiation. Okay, ablation of thyroid means the thyroid by means of some surgery, we can part of thyroid gland is cut out. Okay, then when if the thyroid gland is subjected to the radiation, then it will also cause the destruction of the thyroid parenchyma. Then also it can result into the hypothyroidism. Then second common cause is the autoimmune, that's lymphocytic thyroiditis, which is termed as the primary idiopathic myxedema. Okay, so here we don't know exactly that why this happens, but it leads to the myxedema. Okay, then we have endemic or sporadic goiter that can also lead to the hypothyroidism in the adulthood. Then we have hypothalamic pituitary lesions. Though so hypothalamus and pituitary, the connection which it has, if there is injury to that particular connection, then also it can lead to the hypothyroidism. Then thyroid cancer, then prolonged administration of anti-thyroid drugs, then mild developmental anomalies and the dysharmonogenesis can also lead to the hypothyroidism in the adulthood. Then clinical features of the myxedema, they include the onset is slow and fully developed clinical syndrome may appear after several years of hypothyroidism. The striking features, they are the cold intolerance. That means in during winter season, the person cannot bear that particular cold environment. Okay, so he suffers from that particular condition, that is hypothermia. Okay, then mental and physical lethargy, then constipation, a major side effect of the myxedema, then slowing of speech and the intellectual function, then puffiness of the face, then loss of hairs and the altered texture of the skin. So these are the some of the clinical features of the myxedema. Okay, so the next point, that is goiter, we will study in detail in next lecture. So till that time, we will stop over here, and that's all from my side. Thank you.